For more on measures being taken by the federal government to curtail the spread of the coronavirus, I'm now joined live by the Minister of Health, Ehanire. Thank you for joining us on TVC News at 7. At the last count, Nigeria has recorded 174 confirmed cases of the virus. Now, what are we doing as a government to improve the number of cases being tested?
Well, what we are doing is to intensify contact tracing. We know those who enter the country are carrying this virus, and all those who they have been in contact with. We have, as at the last count, about 6,000 of them. About 71% have been traced and tracked, and the other 30 roughly are also now being followed up. Once they are found, they are tested and they are questioned to know how the connection has been with the index case, and they are put into isolation if they are positive.
The world over, the figures are rising. In the event of a spike, what is government doing to comfortably handle it?
Yes, what we have been doing is increasing the number of beds, and that has been going on very well, particularly in Abuja and Lagos. And luckily, I would say we have had some time to prepare ourselves for a surge. There is a huge tent that's gone up in Lagos, and here in Abuja we have about 1,000 beds that are ready, in addition to the assets that are previously on the ground.
And then we've heard about government hospitals where equipment, including ventilators, are actually inadequate. Do we have a contingency plan at this time?
Well, in the first place, there is no country in the world that has everything it needed to prepare for this pandemic. As you can see on news reports, most countries' health systems are overwhelmed. And we have been able to learn lessons there. We have been in contact with the private sector of health delivery, and we are trying to collect the number of ventilators that we can mobilize and be able to ensure that they can be moved from one facility to where they are needed. So that is on ground. We also have a lot of ventilators on order. Some of them should be delivered within the next few days. But up till now, we have luckily not had to use more than one ventilator more than once. So we do hope that if that continues like that, we are ready.
All right, but considering that even those countries where we're expecting these ventilators to come from, a number of them have also shut their borders and are dealing with the same issue, how soon do you see those ventilators come in?
Well, within the next week or two, I think the first deliveries should come in. They are going to come in by air, flown in by cargo plane. We are receiving support from partners of the World Health Organization, the United Nations group, who have helped us to make the necessary contacts. But quite apart from ventilators, there are other things that we are in need of, personal protective equipment, and even things as simple as masks. We have been doing a lot of training. We are going to have treatment centers and isolation centers accredited by experts to make sure that they are safe and that they meet the basic minimum standards of protecting both the healthcare workers and any other persons who come there. But on the whole, we have looked at all the gaps that we have in the health system and tried to plug all of them to the best of the abilities that we have here.
Contact tracing is said to be one of the ways to nip this pandemic in the bud. But there seems to be quite a number of people out there who have not even been tested just yet. What are we doing to get to them and to get them tested?
Well, there's a targeted testing that we do, and it is to identify those who have either been abroad or they have been contacts of those who have been abroad, or they have symptoms that are extremely suspicious, or they in any way live in an environment where we know that there have been a lot of positive cases. So all of these will be considered. But this is not a generalized testing of population. Countries that have tried to do that have immediately had to reverse, because you now have enough reagents to test everybody who wants to be tested. So there are criteria that are set up. There are some people who do not meet the criteria, and we ask them to just wait for the symptoms. If they have a symptom, then they can immediately be tested. Those who meet the other criteria will be tested, and if they are positive, they go into the isolation ward.
All right, is there any evidence of community infection? People who haven't had contact with an infected person but are themselves showing symptoms and are positive?
We are beginning to have suspicions of that. There are persons who are positive who have not been abroad and who cannot immediately be traced to someone who has been abroad as a contact. So that is disturbing, but the faster we move with our contact tracing, the more diligently we work, the more accurately we work, we shall be able to find the remaining 30% and reduce the risks of having people who are still moving around and are positive enough to be a threat to others. Now, the lockdown of Lagos and Abuja and Ogun State, which borders Lagos, is a very good development because it reduces population mobility. It makes people stay at home so that they are more easily found. The number of people who you would look for and they are not at home is reduced, and also reduces the risk of persons in high burden states traveling to other states where they might seed the virus. So the lockdown has been extremely useful. It's a targeted lockdown, and it's going to be beneficial in accelerating the contact tracing.
All right, and as it is, the whole pandemic issue has actually beamed the searchlight on our healthcare infrastructure and personnel. Post-coronavirus, what is the federal government doing to ensure there is an improvement in the nation's health sector?
Well, not even post. Right now, we're already looking at what we shall need to do to improve health sector responses. We're dealing here with public health right now. That is a threat to entire populations, as you have seen in other areas. And the assets we need, we are going to map out. We know we want one infectious disease hospital in every state. We also want to have personnel trained who are probably doing other things and are ready for call-up if we have a case like this. We also like to stockpile things that will be needed in emergencies of this nature. There are many things that are going to be learned as lessons from this outbreak, and we are keeping a very good watch out.
And in an effort to curb and contain the spread of the virus, NAFDAC ordered the clinical trial of chloroquine and equally ordered the immediate manufacturing of the drug for emergency stockpile for clinical trial. Where are we in this process?
Well, the point of correction is that it is not NAFDAC that did that, and that NAFDAC does not have the powers to order clinical trials. I ordered it, and it's being conducted in Lagos. It is done under the Honorable Commissioner of Health, who is also a public health expert. The understanding of chloroquine right now is that it works in vitro. It appears to stop the development of the virus outside the body, but whether it also works in vitro, that is to say when taken in, is a question that is yet to be answered. The WHO is conducting studies, and in carrying out these clinical trials here in Nigeria, and that's in Lagos, we shall be able to add to the body of knowledge. And it's not only chloroquine, it's also hydroxychloroquine and azithromycin, which it is said were helpful in France. But we are looking at all options. Nothing is being discarded, and we are studying what is best for our citizens and also listening to advice from the World Health Organization, which, as you know, is the umbrella institution that takes care of global health.
Minister of Health, Nigeria, Ehanire, thank you for joining us on TVC News at 7.